Have you had back pain for over a year, maybe 6 months, and nothing seems to make it go away? You've tried physical therapy, you've tried maybe even injections and surgery, and you're just looking for the next thing that's going to help you. Maybe you are even considering revamping your exercises. You think that your core is too weak. I want to talk about that today and talk about what specifically you need to do, the top things that I do as a physical therapist to get you pain free and keep it that way. I'm Dr. Jake GIESE. I'm a physical therapist and certified personal trainer, and I specialize in helping hikers and outdoor enthusiasts, adventurers, stay pain free and on the trail, specifically helping people that have back pain. And usually it's chronic back pain that you've had for over 6 months to maybe even a year. It's frustrating and they don't know why it's happening. So, first off, I want to give a personal story of how I specifically help someone with back pain, somebody that has had numbness and tingling down their entire right leg. They went to a chiropractor for like weeks, then going on into months, and they got temporary relief, and then it would come back. And they noticed over those months that they just kept getting weakness in their right leg. And then eventually they started getting foot slap where their foot would slap the floor. And then I went to see them for one visit and we did a exercise called, well, really it's a technique called muscle energy. And muscle energy helped this person in one visit. And this guy is one of my good friends, Sean. Shout out to Sean, Hoka Pizza. And yeah, it was really awesome for him and me because in one session, literally 20 minutes, I was able to change his life. I one, stopped him from having pain. Two, stopped him from having the numbness tingling and stopped him from having the foot drop. And he didn't have to go to the doctor to get further imaging. He didn't have to go to the chiropractor. He didn't have to deal with that anymore. And he knew exactly what to do. All right, guys, I'm going to show you how to do a muscle energy technique that I give patients. You know, there are more beneficial or easier ways to do it when you're in a clinic, but these are ways you can do it on your own without a therapist, and all you need is a wall. So what you're going to do, this is going to be specifically for people that have a lot of tightness in the low back running across, and it can be either on one side or bilateral, meaning both sides. And what you're just going to do, this is the one that I had Sean, one of my previous clients. I saw him for one visit, and in 15 minutes, I did this exercise as well as some other things, and he no longer really had that issue. You're just going to find a wall or a door, you're going to lean against it, and you're going to contract by pushing your hip out. You should feel this tighten up in your low back. You're going to hold it for 5 seconds, and then you're going to push that hip in. So if you watch here, I'll put my hand on my hip so you can see it better. I'm pushing my hip out. My shoulder is still staying attached to the wall, and then I am holding it for 5 seconds out and sliding it back in. When you push it out like this, you'll feel contraction on that side, the side closest to the door. So in my right here, this is my right side, I'm feeling it on that side. Then you would go ahead, you would do it on the other side, you would do that same contraction. So you're doing 5-second contractions, 5 to 10, but I usually do 5-second contractions, and you're going to do that 10 times. So now I'll show you on the other side. I'm going to face the other way. You're just leaning against the wall like this. Now you're just going to have that hip against the wall. You're going to push it out, and you're going to feel that in your hip, kind of, or in your low back hip area right here. You're going to hold it and then come back in. And then out. Hold it 5 seconds. 1, 2, 3, 4, 5. If you don't feel that, what I would encourage you to do is actually, when you're in this position, when you have your hip out, I want you to push the side that is closest to the door or the wall into the ground. So you're going to like push that foot down and almost feel like you're lifting your other hip up. So basically you're doing this motion. You're kind of pushing the foot down and kind of, you're keeping that other foot on the ground, but you're just kind of like going up onto your toes. You're lifting up your heel, okay? So you should feel tightness on the side closest to the wall. That's the muscle energy technique for the low back, kind of doing the entire arch of the low back right there. So that's muscle energy number one. For a lot of the clients that I see that have had chronic pain, pain that has lasted more than 3 to 6 months, maybe even a year, and it's back pain, it's oftentimes associated to either tight musculature that kind of causes spikes and then reliefs of pain, and or maybe nerve pain where it's kind of constant in nature, causes numbness, tingling down the legs, the buttocks. Those are the two most common types of back pain. Now, a lot of times people, when they experience those, they either go to YouTube and they end up finding stretches or core strengthening exercises. Particularly, usually it's going to be a sit up, a bird dog, maybe some sort of oblique side plank. And you'll find those through a variety of different authors, whether they're physical therapists or chiropractors. And the thing is that those specific exercises are not tailored to you. That in reality, maybe you are actually weak in other areas, like your external rotators of your hip, your internal rotators of your hip. Maybe you have increased pronation of your feet, and you have kind of like a valgus positioning because you have weak glute medius. You might have a weak glute in general. So as you can kind of see, a lot of this is related to usually weakness in muscle groups that we might not have or might not use all the time, particularly our glutes. Our glute medius, glute maximus are usually underutilized. They're not weak, but they're underutilized. Another thing is that I have a free guide. It's an ebook on how to help you reduce your low back pain. It's going to be in the comment section. It's going to be in the description. Go ahead and download that. And all I ask is that you provide your name and email. I'll send it to you through your email. And then it has a kind of a step-by-step assessment for you that you can determine, what positions cause pain if they do. And then from there, it will give you specific exercise recommendations based on that. So if that's something you're interested in, go ahead and check that out. It'll be in the comment section or the description below. And if you like, please like, comment, and subscribe. It helps out the channel tremendously. So, but let's get into it. Now, a second muscle energy that you can do is primarily for like SI joint pain. So we have our lumbar region right here. This is the small of our back. Underneath it, you have your sacrum that looks like this with your sit bones right underneath, okay? The SI joint is right here. It's where basically your two iliac crests come down and they come together and they meet your sacrum in the middle right there. In that SI area, there's a lot of different musculature that can generally be tight, overused, or weak. The piriformis muscle runs through there, the glute medius runs through there, and all of them can either be tight or weak, causing a lot of pain. So those muscle imbalances can lead to tightness or changes in the pelvic positioning that result in more pain. A lot of times people have pain in that joint, especially after pregnancy. Maybe you fell at some point, you had some sort of jolting injury, car accidents. And I've also seen just general tightness of the hips can cause SI joint pain. So with this, there's a muscle energy technique that I usually prescribe to someone. And you do this by laying in bed, on a floor, on a exercise table. And the whole concept of it is that you're basically going to create a muscle contraction that is equal on one side to the other side. So what I mean by that is when you lay down flat, you're going to lift up one of your thighs, then take your hand, you're going to put it on your knee. You want this knee as close to your head or shoulder as you can. I'm not that flexible, so this is as far as I go, but some people can get their hip really high. Now, you're going to push with your hand against your knee, but don't let it win. Don't let it win like that. I want you to keep it in one spot. You want your leg to work really hard here, and you're just pushing against your hand, but don't let anything move. Now on the other side, I'm just going to put this down for now to show you. The other side, we're actually going to hook around the back side. So not on the front, but the back. And now you're doing the opposite. So now the hand is pulling it up, but you're not going to let it pull up. You're just going to push that leg down that way. So it looks like that. So what you can do, you can either do this like kind of like, with one leg up, but I usually do it with two because this helps with the SI. So what you're going to do, we'll start with, you're going to push down with this hand, and then you're going to pull up with the other hand. You get your foot up, your hips up into 90 degrees like this, heads down, and you're just basically pushing down on, say, the right side, and you're pulling up with the left, and you're going to try to hold this for 5 seconds. You're doing a maximal, like a submaximal, maximal contraction on both sides. Now you're going to switch, and what you'll find is that one of these is probably easier to do. So these muscle energy techniques are things that you can do every day, and it can be kind of your routine where if you're in pain, you can do them, and you can do them to prevent you from being in pain. So kind of like the more you do, the better it will be. So instead of getting cracked by a chiropractor or PT or somebody all the time, you can do these as kind of self-release techniques to help you in general reduce your low back pain and keep it going. Okay, so the concept of this is muscle energy. Muscle energy basically means we're telling our nerves in our brain to contract one set of muscle groups instead of the other. The key concept of this video is I want you to understand that back pain is so specific to you and individualized. So you cannot always just go on YouTube and find videos like this of these specific exercises and that's going to fix your pain. Now, it might, because maybe you actually had that going on and that's why you fixed it. But in reality, most of the time we need an individualized session and evaluation to figure out what's going on and then find the root cause of what is going on so that we can fix it. You can do a lot of exercises and feel really good, but maybe you have chronic pain because you're actually not fixing the root cause. So if you're someone that is looking to fix the root cause, you're sick of this low back pain, I highly recommend that you download the ebook, but also reach out to me. I'll put my email down below as well. If I don't, just message me, say, hey, I'd like some help, tell me your story. And as always, please feel free to share your stories. It kind of inspires others to reach out as well. And I know a lot of people have problems with their low back. So please, if you'd like to, you can share your story, what worked, what didn't work. And I think it will help a lot of people. That's the whole point of this channel, is to help people with low back pain and other issues get back to their trail or their adventures and do the things that they really want to do. So please comment, please like, subscribe. It helps the channel tremendously. And I hope this really helped. If you have questions, you can email me personally. And have a great day. I'll see you on the next one.